Hello, thanks for your interest. This video is a segment from a National Lesbian and Gay Journalists Association New Ways seminar. Stay tuned for more opportunities to learn skills and strategies for news coverage of HIV and AIDS.
So we're going to start this first panel, and we've named it The Journey, How HIV/AIDS Reporting Has Evolved. And our guest, I'll let our guests introduce themselves.
Hi, I'm Randy Gill. I'm the curator of modern political and historical collections at Emory University's Stuart A. Rose Manuscript Archives and Rare Book Library.
I'm Dr. Jesse Peel. I'm a retired psychiatrist. I've been involved in HIV and AIDS work since the early 80s.
Hi, I'm Charles Seabrook. I came to work for the Atlanta Journal-Constitution in January of 1972, and we're still calling it the Communicable Disease Center.
Oh yeah, I met this remarkable man a few years ago, and we've started collecting materials that actually document the HIV and AIDS crisis in Atlanta and in the South, because there weren't many materials and not many repositories that collect it. I compare it to where civil rights scholarship was in 1970. When you talk about HIV and AIDS, you hear about the top down, which in the civil rights movement was Dr. King, Malcolm X, people like that. But with HIV and AIDS, what you hear about is San Francisco, New York, and Los Angeles. What I've learned, and what you all know, is that every town has an HIV/AIDS story. Atlanta has one. Valdosta, Georgia has one. Bowden, Georgia has one. And so what we're trying to do is create materials that document the crisis. So we have everything from a scrapbook from Wills Bivens that has photographs from the first Pride March in New York City in 1970, snapshots that he took. Dr. Peel donated his collection to us. We have his appointment books here. And so this is an appointment book from 1989. And in the back, he has a list of names in it. This is everyone that he knew that died from HIV and AIDS in 1989. You kept track of that for how long? When did you quit keeping track of it?
After I got to 100, I just quit counting.
Now, think about that for a minute. I don't have 100 people in my life to die. Imagine getting to 100 people who die from a disease and then still counting. That's what the urgency in the crisis has been what's missing, and that's one of the things that we're trying to document in this collection. Jesse, were you out in the streets demonstrating?
Oh no.
That was a trick question. But we also have the papers of people who were out in the streets demonstrating. We actually have David A. Lowe's arrest record, and if you look at his mugshot, he's smiling because he was protesting treatment of HIV and AIDS, and he was very happy to get arrested. We have his arrest citation and the photograph, his mugshot. So it's those types of materials to tell the story that has been basically undocumented so far in terms of the historic impact.
Dr. Peel, describe for us what it was like kind of late 70s, early 80s when we first started to see HIV/AIDS appear. The medical community didn't know much about what was happening, and it was just a different time. Take us back to that time.
Well, I was in a large psychiatric group and was the token queer doc in the group, and I had wanted to cultivate a gay practice. By the early 80s, about a third of my practice was gay men. Careful what you ask for, because then young men started coming in with tales of their friends having gotten sick. I had one young man come in that had lost 3 of his best friends in the last month. You would go into funerals every week or two. It was a time of great fear.
And when people would come to you in those early days, did they understand what was happening?
The folks in the gay community, a lot of us understood a lot more than some of the medical experts. We tried to empower patients to to be assertive in their own health care, to be a partner with their physician, so that they could educate themselves about what was going on, because a lot of doctors didn't have a lot of information about AIDS at that time.
When someone would come to you in those early days, what would you tell them?
You needed to take care of practical things, for one thing. You needed to have a durable power of attorney so that you would have somebody you trusted and knew that would be making the medical decisions for you if you couldn't. Because oftentimes families were not supportive and would try to exclude a partner if they could. You urged guys to learn as much as they could about what was going on, to learn about treatments, to not just be passive in their health care. They needed to be a partner with their physician.
When you stopped counting at 100 names, what was that moment like for you?
You go to a funeral every week. You know you're living in strange times when you start critiquing funerals as an art form. But after a while, I got to the point, I just can't go to another one. You have to take a break. I'm not sure that answers your question.
Sure.
Also, he started doing what he told his patients to do. What'd you do?
I started journaling. I started keeping a journal in the early 80s. I think it was 83 when we started. And over the next 10 or 15 years, I accumulated 14 of these ledgers, handwritten ledgers of, as I wrote about my dysfunctional relationship, the politics in the community that were at the time, family issues, trips that we took, hot sexual encounters when they occurred occasionally.
I remember those, right?
Nobody was ever going to read this. I kept these journals until the late 90s, and by that time the three-drug cocktail had come out. The crisis had begun to subside in that the dying had slowed down, and there wasn't as much imperative to write anymore. So I caught up a lot of that when I had these transcribed back about 10 years ago.
So Jesse, when you were diagnosed, when did you want to live to? You had a goal. When did you want to live to?
Well, that was when I retired that I had that goal. I got my diagnosis in, I think it was 87 or 88, and I'd been, I went on the board of AIDS Atlanta in 1984, so I was sort of at ground zero from that point. I retired in 1992 after about 10 years of involvement. And my goal at that time was to live 4 more years until the Olympics came to Atlanta. That seems like a rather modest goal, but 4 years back in the 80s and 90s was a lifetime. And the Olympics came and went, and that was the same year that the three-drug cocktail came out. So I set my next goal to the millennium and continued to set short-term goals after that.
And it's a birthday on Tuesday.
76.
So your private thoughts are open to the public to see, right?
They are.
I laid them all out. And when I had these transcribed, I didn't do any censoring.
He did not. I can vouch for that.
I figured the only person that was going to be embarrassed was going to be me.
When you go to the CDC, every week for the MMR report?
I was.
Yeah.
Can I mean, if I can just get a little dramatic.
Let's do it. Yeah, go for it.
Like I said, I came to Atlanta, and I was hired as a science and medical writer in January of '72. The editor at that time, the managing editor, who became my friend, says, we have something called the Communicable Disease Center here in Atlanta. And I think you should cover that thing. And of course, I went out there and introduced myself. And at that time, this was long before 9/11, you could go into CDC, there was a semicircular driveway in front, all the way to the parking place there. Park there, you could park there all day, nobody'd bother you. Walk into the lobby, wave to the guard, walk down the hallway, and the public affairs office was always on the first floor, and that's where I picked up the MMWR. Because the guys told me, he says, well, if you're going to cover CDC, you need to see this. Now, at that time, I had no competition. I mean, a lot of my competition thought it was leaked to me. If they couldn't figure it out, I wasn't going to tell them. But I would come back and you could get all these stories out of there, all these public health stories. And I went on like this for years. And then, Don Burress, who at that time was public affairs editor, I'd go in there and talk to him. We'd discuss football or something like that. And then he'd get around saying, now let's see what's in the MMWR today. And if there was worthy of a story, I'd just go down a hallway somewhere. Do that now and you get shot. But I'd just go down and knock on the door of the doctor who might have written it if he or she were there, or phone call or do more reporting if necessary. Well, let me just tell you, now you said 70s and 80s, but the first report ever on what we now know as AIDS was published in MMWR on June 5th, 1981. There's certain things in life you remember. I remembered that. But I went in there and Don, he didn't want to talk about football or anything. He says, Charlie, take a look at that second item there in the MMWR. Turn. And there was something like pneumonia cystis carnii in Los Angeles, 6, and it said, this is the language they used, 8 homosexual men. Several of them had already died. This kind of condition, as you know, was rarely ever seen. And I said, okay, Don, what about it? He said, well, this has got them stumped. Any publicity you could give on this thing. Now, the CDC never asked me for that. They're always nice people and helpful, but never had asked me. So I said, okay, it's going to be rough, though, going back and telling them to write a story about something in Los Angeles that you guys are going to probably solve in about 3 weeks anyway. So anyway, he says, anything you could do. And I never heard that from the CDC before. So I was walking out, and I ran into, this is, sometimes fate, I ran into a guy named Jim Curran. Jim Curran was sort of a grunt at the time in the sexually transmitted disease section of CDC. And he says, Charlie, did Dante? I said, yeah, Jim, what's going on? He said, Charlie, this thing is, is bad. It's serious. He says, we've already got some more cases being reported elsewhere. So anyway, I came back because the CDC did a lot of favors for me. I just wanted to try to get something in the paper, especially since they'd asked me. But it's going to be hard to get something in the paper about something that went on in Los Angeles, And then when you read the report, it was, when I read the report, a lot of these folks were taking something called PCPs or whatever, or sexual enhancements and that sort of thing. And I think I read this thing where some were having 4 or 5 sex partners a day. Well, what do you expect? Something like that is somebody's bound to come down with something. So anyway, that's my thinking. So anyway, though, I persuaded the paper, and yes, I had an editor who said, all right, Charlie, he'll run it. So I read it, about that big. I've been told that was the first report. Now, not the first report, among the first reports ever on what we now know as AIDS, because they weren't calling it AIDS at that time. I wrote the first report based upon the MMWR, and I think the New York Times, the LA Times, a couple others wrote it.
And for those who don't know what the MMWR, it's the morbidity and mortality.
Weekly morbidity and mortality report, and what we used to call was the gloom and doom report.
So every week the CDC tallies who died of what, and basically just.
Well, it's basically about public health developments, and it's a quick way of getting people, getting the word out instead of waiting several months for it to be peer-reviewed and published in a medical journal. I think Dr. Peel could back me up on that.
In those early days when it was largely considered a promiscuous gay man's disease, how hard was it to get?
Well, it was hard because there was a tremendous stigma attached. But there was also one other thing that I was sort of up against. I had the CDC in my backyard. Every time I was at the CDC now, they were telling me how serious this thing was getting. I knew how serious it was getting, and I thought, even then, well, they're going to solve it. This is back in the early, 80s. We didn't have any reports from Atlanta. And when I talked to the folks I knew in the gay community and friends, they said, "Oh, that's all that crowd up there in Los Angeles and San Francisco, that bathhouse crowd up there." That was the attitude. We're a monogamous community here in Atlanta. Which
Not so.
But anyway, well, of course, then we had our first case on. Now, this is stigma.
When was that first case? Do you remember?
I think it was late 1981, and finally some editors came around and they realized, because now the New York Times is beginning to report it. We might report it too. You ran across that situation. If the others are doing it, we better do it too. So anyway, it was late 1981 or 82, and a matter of fact, my wife was a nurse at Piedmont, and I think she was saying, they got this tremendous thing there, the patient all in a tent and everything. And so it was at that time then we had enough information, this thing was getting big enough that we decided to do a two-part series. The answer to your question is, I'm not sure exactly when, but when we wrote that first two-part series, we mentioned the doctor's name. You maybe probably remember him, Dr. Peel, but we mentioned his name. And there was such a stigma that he threatened to file a lawsuit against the AJC for mentioning his name in relation to treating the patient. I don't think he'd had a chance of winning, but that same doctor became an activist later, and he was arrested, one of those people arrested at the when they had the big national conference in Washington in 1987. I forget his name, I wish I remembered it. But I remember, and the CDC was letting me into a lot of these meetings because the Red Cross was in a whole total state of denial at the time. It was obviously there was a bloodborne disease, although they didn't have a virus yet. There was a bloodborne disease. They were trying to persuade the Red Cross that we have a problem here. And I went to some of the meetings at CDC, and I tell you what, you're talking about Republican convention getting in a little tiff, and you watch them, but you should have seen it that day, and they were meeting. And finally the Red Cross came around, and started issuing questionnaires and so forth and so on. Then I was there that day, because at that time they're calling it GRID. Gay-related indigent immune deficiency. They had some other names for it too, but because you're talking about terminology, going back there, they didn't have any terminology back then. They were just going by the seat of the pants. They didn't know what to call this thing. So anyway, then I was in there that day when they decided to name this thing officially AIDS. That was about a year or two after the first report had already been published. And then after that, we finally came around, and I was getting stories in the paper almost every other day. And AIDS became, for me, I was 80 to 90% of the stuff I was doing, and I became burned out on it.
So we only have a few minutes left, and I want to open the table just to reflect on, in those early days, what HIV/AIDS meant to you. And you can take that wherever you would like. Rainey, let's start with you.
Well, what I've learned is what y'all talked about, the stigma. Dr. Peel told me he went to go see his patients in the hospital in the early days, and their food plates would be outside their doors. Why would their food plates be outside the doors?
Because the nurses wouldn't take it in.
So there's this kind of fear and this stigma, and also the urgency. People were dying from this disease that's missing now. People are still dying from it, but the students who are out there, for as long as they've been alive, AIDS has been a treatable disease. May not be fun, you have to have money to access the drugs and all that, but it's not the death sentence that it was in the time period that you were. And so a lot of this, the urgency, what we have, if you look through the AIDS collections we have, you see HIV shaping the whole aesthetic of the community. If you want to talk about do-it-yourself culture, let's talk about the infrastructure that you had. They had to create it. And it runs through arts organizations, it runs through Open Hand, Open Hand started because one gentleman went to St. Bart's Church and made a meal for his friend who was too sick to feed himself. That's how Project Open Hand started. They had to create this scaffolding, and so it's an amazing story of a kind of do-it-yourself aesthetic to respond to an epidemic.
Getting the diagnosis was essentially getting a death sentence. There weren't any treatments. Some of us survived long enough until drugs were available, but it was a matter of not if, but when you were going to die.
You know, sometimes I've been asked, when did AIDS become a household name? When did it finally, the people, I don't know whether it lost its stigma, or at least the stigma was not as bad, and that was, I can tell you almost today, it was the day when Rock Hudson died. Because Rock Hudson, if he can die from it, you know, because at that time Nancy Reagan and Ronald Reagan was almost in a state of denial for a long time.
Not almost.
Wouldn't say the word, wouldn't even say the word.
Yeah, but when Rock Hudson died, a good friend of Ronald Reagan and Nancy Reagan, Elizabeth Taylor, who was good friends with her, that's when my life became almost even more miserable. Because now, you know, they thought, my editors thought we owned that AIDS story because I was consistent and persistent in reporting it. And then, you know, everybody in the world was just going, you couldn't get enough AIDS stories in the paper. Mm-hmm. And my life became miserable. I can tell you one quick story. There was a reporter in Los Angeles who sometimes they would leak stories to her because she was the only one who was going to publish it without question. She was at the LA Times. I shouldn't say this, but that was exactly what happened. But if they wanted a trial balloon to go up, the Public Health Service or whomever, they would, like, you know, proposal to test all women in the hospital who came in to deliver a baby, test them for the AIDS virus. They'd set up this little trial balloon. And we didn't, a lot of us didn't do it because we didn't want to be used, you know. But then, of course, the editors, they'd call me at 10 o'clock, well, the LA Times come. I'd be going back down to the paper and calling, you know, the CDC people, Jim Curran and Harold Jaffe, would be calling them at night. But that was the turnaround. And that's when I think AIDS really started to, I don't know whether you agree, Dr. Peel, but when AIDS started, the stigma started to, you know, let's deal with this thing.
That was certainly Rock Hudson's illness was pivotal. But at the same time, when Princess Di was photographed holding AIDS babies, that had an enormous impact on people. There was so much fear and loathing. It's hard to really imagine the level of fear that there was at that time before the virus was isolated.
Do you remember that guy down in Miami, Whitehead Institute, Tropical Disease Institute, who was telling everybody, We got evidence it's spread by mosquitoes.
That's
Guy
where the
named
Joe
Chuck,
Glade,
and a guy named
Christensen
Chuck
from.
Ortlieb, who ran a gay newspaper and a very influential gay paper in New York. He was touting everywhere that it was spread by pigs, and you know all this misinformation is out there, and having to deal with all of that. And the problem is, for all my journalism friends out there, you know, if you ignore these stories, somebody's going to pick it up. Then when they pick it up, why the hell don't you have it, you know? And so I've learned to deal with the thing, you know, and no matter how crazy it was, you got to deal with it at one point, because somebody else is going to run it, and then the editors are going to know, why didn't you have it?
We'll have to stop there. Please join me in thanking our panelists.
Thank you for watching, and a special thanks to all of our speakers. This has been a National Lesbian and Gay Journalists Association presentation. Learn more about reporting on HIV and AIDS today at www.nlgjA.org/resources/newways.